I am on the last day at LTC 100 in Scottsdale. I'm talking to Dr. Daniel Kraft. He just finished a fast-running, powerful talk on the possibilities of AI. And so I'd love to hear, there was like dream big stuff that you presented, right? And it was pretty overwhelming. So if I'm a senior living operator and I've maybe tried ChatGPT or Claude, and I think I know I need to get AI, where do I start?
Yeah, the world is moving so quickly in this AI GPT world. It's about starting, right? It's not about waiting for this future to arrive and come with a bow on it. Start going, and many folks and our patients and our family members are going to ChatGPT or Claude and putting in their own medical records in labs and asking questions and sometimes skipping the doctor visit. So you can start to see the power of these tools. And many of them are hyper-specialized to primary care, to long-term care, to self-care. So I think part of the opportunity for building the future is not waiting for it to arrive, to trying it out. I mentioned in my talk, I built a platform to help make sense of the growing infrastructure. It's a website called digital.health, where we have 5,000 AI and other solutions that you could use for your own health, like a wearable or a platform to help you manage your practice and billing, and a lot of tools out there. So the big picture is, see what your pain points are. You might have a pain point with discharges or fall prediction. See the solutions that might exist. See how you might integrate them in. It's not all about a bunch of point solutions, but how could you start to build a bit of a platform to integrate the solutions and data to meet your own hyper-personalized needs as a human, consumer, patient, or someone running a healthcare facility?
Okay, so I think that makes a lot of sense. There are a lot of people who are really afraid of it. And one of the things you touched on today is it, I'm going to put some words in your mouth, a little bit rephrasing it. Is there danger that it's going to rot our brains?
Well, you mentioned like all technology is like 3D printing. You can 3D print a medical device or 3D print a gun. AI can be used to design a new vaccine or a bioterrorism weapon. But also AI might start to this idea of de-skilling, right? If you might be a good writer or a video producer and using AI to do all your work for you, you might lose those skills. Or if you're a kid learning in college and now and you're using it to write your essays, will you ever be a good writer? So there's a balance between leveraging the upskilling that AI and these agents can do, but also maintaining our humanity and our capacity. So that's a big issue. There's also de-skilling, like clinicians losing their skills when they use AI. So I think we need to be cognizant of that. But the plus side is it can upskill us, right? It can enable a nurse with less experience to integrate massive data sets and bring hyper-personalized care. It can accelerate learning to you based on your age, culture, language. I mentioned in my talk this whole realm of agentic health. Again, the way we interact with information, personalized learning can be highly tuned to us and adaptive and see where your blind spots are and see that faster than any teacher or coach could.
Okay, so one of the things I wonder about a lot, and this is, it's part, I guess ultimately it's all about technology, not necessarily AI. I think that one of the things we've seen medicine do is expand people's lifespan. And you touched on the health span versus lifespan. I agree with that. But when I look at particularly the aging services, skilled nursing, assisted living, I wonder if we're putting all this technology in and we're making people's lives longer, but the quality of life. I manage the care for my 93-year-old stepfather who's got dementia. And one of his old friends from the Silicon Valley, that's where he lived, he went to visit him yesterday, and he's in a little wonderful 6-bed community in Sacramento. And they came back to my wife and talked to her. They were quite distressed because he was telling them how he still did his own grocery shopping and driving and cooking, which none of that he does. It would be unsafe for him to do. And so are we really doing him, and there are people he's in with this community with who are much worse further down the dementia road. Are we really doing people a favor when we extend life?
Yeah, it's not about longevity. You don't want to be 120 and feel 120 or 91 or 51 without your faculties. We need to think about extending our brain span to match our lifespan and our health span. This idea of health span is you want to extend the quality of life, health span, and shrink our sick span, right? So, we know that we spend a lot of our dollars in the last couple months of life where we kind of often torture people. Maybe many of us want to live to 100, be super vigorous, connected, have sense of purpose, community, and then have a very short decline. We have to think about the end of life as well.
Yep.
But yeah, it's not just about adding, more months or more years, but thinking about how those become quality and how do we find folks before they get dementia, identify them using new technology. Sometimes it's looking at the back of the retina. Sometimes it's blood biomarkers. Some of the new drugs coming to market might be useful starting at age 50 or 60 when you're showing the early risk to prevent you from ever getting that. So we've got the challenge of being proactive and preventing issues of cognitive decline and other medical issues, but also the ability to hopefully better manage and give better quality of life to folks who have them today.
Okay, so what's it going to be like in 5 years? You talked about how we're accelerating. You talked about Moore's law. It is growing better and faster, more than anybody could imagine.
Yes.
What do you think medicine's going to look like in 5 years? Aging care is going to look like in 5 years?
Well, the future is coming a bit faster than we think. Sometimes the technology is going, again, faster than we can keep up with. Regulatory policy, ethics, healthcare, sick care is still built on fax machines and often paper charts.
Yep.
And that legacy systems are harder to often change. Sometimes it's less about the technology, but the old mindsets and the old legacy systems, and sometimes old out-of-date platforms like HIPAA, which are well-meaning, but you need to bring the regulators and the policy folks along with you to bring that future. But I would argue, like 5 or 10 years, the art of the possible is that every patient before and when they're in a long-term care facility or hopefully getting discharged to regular life, we can build that data model around them so we can hyper-personalize their care. We can understand proactively where they are in their health and medical journey and not give them this sort of standard of care or one-size-fits-all, but the ones that really understand where there's a risk of fall or sepsis or what medications that might really drive better outcomes or the personalized physical therapy. Build that sort of wrapper around them and then be able to integrate not more data. No one wants more data from your wearables and your genomics, but synthesize those sort of dashboards of care. Some might come, as we talked about, through augmented reality glasses, so that's more seamless. The charting becomes ambient and done in the background. So the care process for both the patient and the caregiver is more smooth, less about charting and billing, and more about true personalized care that's integrated and synthesized. And the care journey can almost be like we're here speaking in Phoenix, so Waymo is going to take me back to the airport. But if health care from long to chronic care, et cetera, was more like a self-driving car, comes on demand, your name is on the top of the car when it arrives, it has transparent pricing, it adapts to the traffic and the weather, it's crowdsourced its knowledge set. I think if we kind of connect the dots between all these new multimodal data sets, part of our future care is building better healthcare journeys that are informed by others' journeys and making it less frictionful, kind of like Waymo and Uber has made traveling a little easier.
So one of the things that you touched on that I'm really intrigued by is, will AI actually become, for maybe low-level things, my doctor? And I'll give you a very personal example. So I've gone through for about the last 6 months this cycle of sick health. Seems to be sinus oriented. Went to see an ENT a week or so ago that got them to do cultures, got the results back, and I've got some bacteria in there that probably needs an antibiotic. And so now I'm waiting for the physician to respond to that. And I've already run it through ChatGPT, and ChatGPT says, well, you need this or this. And I'm thinking, why couldn't AI just prescribe that medication, send it to my pharmacy doctor? Because the doctors, I guarantee, will do the same thing that ChatGPT will say. Is that going to happen?
Yeah, I mean, it already is in the path of it may be malpractice for your clinician not to use AI to pick the right drug or the right therapy. So there's some challenges, ethical issues there about, what is standard of care. But, you had to wait for that ENT visit. Now you're waiting for the cultures. Now you're waiting to get the feedback loop. Today, as you said, you can go to GPT and it can give you guidance. But now we're seeing the emergence of the platform called Doctronics in Utah, where the AI is allowed through the regulations in Utah to do drug refills. Not yet prescribing, but they're on the way to saying, okay, let's pick something more common. You have a home urinalysis test that shows you have a UTI. It might prescribe the Bactrim for you for your first pass, right? And so save you the time and risk of having a renal infection and all the friction of care. That might be on the path to happening for more simple elements. It'll get more and more complex, particularly because we have a shortage of doctors, nurses, prescribers. That will become integrated, particularly where there's care deserts. It has to be carefully done, but for certain examples where there's less risk, we're not talking about open heart surgery, some elements could be agentified and optimized. But we can't go too fast. We want to be exponential, but some things need to be done carefully and see how they turn out, kind of almost like a clinical trial.
Right. Well, so I'm going to, one more shift that you talked about is that you showed you were going so fast because you ran out of time with all your material, but you showed patches that appeared to be sort of the next version of my Fitbit,
Yep.
and so I'm looking at that, and right now in the senior living space, there are, it seems like 1,000 companies selling sensor technology, radar, LiDAR, camera stuff to watch people's behavior and that kind of thing. And I'm wondering if all of that stuff is going to become obsolete when I can put a patch on there that will do a better job of fall detection and measuring everything.
Yeah, I mean, it could be bring your own device from your Whoop to Apple Watch to Fitbit, because they're already a pretty good sensors for picking everything, who's likely to have a fall, to changes in heart rate, to blood pressure. There are now platforms. This one is called BioIntelligence. It's a patch that's FDA cleared, I believe, that is a couple dollars a day. I think this one's rechargeable. That's basically an intensive care unit level on a patch. Now, no one needs ICU level care, hopefully in most SNFs, but when you can tell changes in vital signs, position, temperature, step, mobility, that gives you overwhelming amounts of data, but no one wants the data. When we can synthesize that and you can get that proactive check engine light as well as guidance, that could really improve care. Yes, some can be patchable, some can be radar-based, like Circadia and others, to bring ambient sensing. I think the combination of merging those modalities can give you a much better picture of where people are, who's likely to have sepsis, a fall, other complications, and then guide your care in a much more efficient manner.
Yeah. So anyway, this has been great. It's so exciting to look at. And I think that it becomes easy to say, well, that's the future, but it's like the future is here.
The future's here, and it's, again, this convergence of technologies from AI and sensors and big data to augmented reality to robotics. The challenge for folks is to keep up with what's there and sort of help build that future in a more smart, collaborative way, because you don't want to wait for the future to arrive and you're behind the curve. I mentioned I've been running a platform called NextMed Health, nextmed.health, where we bring folks together to cross the spectrum from mental health to psychedelics to chatbots to drones to nanotech to sensors to patches. It's about how do you see a problem, see what's already out there, connect the dots, and build that future collaboratively, because the old models of subspecialty care and gadgets and widgets and AI and sensors all need to merge and to build sort of operating systems for healthcare, not just technology platforms. Well,
and I think that some of this, particularly the long-term care space, is about incremental gain. So I'm looking at that patch that you had there, right? If every resident was wearing that, it means you don't have to wake them up to do vitals. It means you don't have to spend caregiver or CNA or nurse time doing vitals. You just have it there. And so I think those incremental gains are for at least long-term care, the practical way to start. So,
yeah, small incremental elements, finding your pain point, looking for solutions that might already exist that you can integrate in, and being thoughtful. There's this phrase I shared in my talk that the challenge isn't the new ideas or the new technology. It's often the mindset. People are stuck in their old ways, and now we have this opportunity to reshape everything from the acute and urgent care to long-term care, and to skate where the puck is going to be, because the future is very exciting. We need to build it collaboratively together, not just with the technology of 2026, but what's going to be here in 2030 and 2036. It's a brave new world.
It is. Daniel, thanks so much. Appreciate it. Appreciate the talk.
Thanks so much.